If your DOT physical got held up because of a health condition, a specialist might be the missing piece that gets you certified. Here's how it works. The DOT physical is built around one core question. Are you healthy enough to drive safely? Most drivers pass without any issues. But if you have a condition that falls outside the standard limits, the medical examiner may not be able to certify you on the spot. That's not a denial. That's a flag, and it means more information is needed before the examiner can sign off. That information usually comes from a specialist. Take heart conditions. A cardiologist can document that your heart is stable and that driving doesn't put you or anyone else at risk. Diabetes, especially if you're on insulin, requires specific FMCSA forms, and an endocrinologist can walk you through that process. Sleep apnea is another big one. If you've been diagnosed, a sleep specialist can confirm you're using your CPAP and that your therapy is working. That compliance record matters. Examiners look for it. Neurological conditions are handled similarly. If you've had seizures or a significant head injury, a neurologist may need to weigh in. Mental health history and certain medications can also prompt a specialist consult, typically with a psychiatrist. And if your vision or hearing is borderline, an eye doctor or audiologist can verify that your corrected ability meets the federal standard. So what actually happens if the examiner needs more? A few things are possible. They may issue a short-term medical card, say 3 months, while you gather the documentation. They may ask you to come back once you have a specialist's note in hand. Or they may pause the certification until they hear back. None of that means you're disqualified. It means the process isn't finished yet. When you do see a specialist, be specific about why you're there. Tell them you need documentation for a DOT physical. Ask for a current note that summarizes your condition, describes your treatment plan, shows your compliance history, and includes a statement that you are fit to drive a commercial vehicle. If FMCSA requires a special form, like the ones used for insulin-treated diabetes, make sure your specialist knows that up front. The practical takeaway here is straightforward. If you've been told you need a specialist before you can be certified, don't wait. Get that appointment scheduled. Be upfront with the specialist about what you need and bring complete documentation back to your medical examiner. Chronic conditions don't automatically disqualify you. What disqualifies drivers is missing paperwork, and that part is fixable.